Hi, good friends. It's nice to see some of you. I'm calling in from Vancouver, Canada, which I'll explain in a minute. But I'm an audiologist and a neuroscientist. As much as my title on the screen says neurologist, I'm a few years short of training to be a neurologist. I'm not an MD, I'm a PhD. I'm also a public health advocate, and you may know me as a retired professor from the University of Washington. I'm calling in from Canada because part of that retirement meant moving north a bit to help out with aging parents with dementia. Despite that physical move, I still have a footprint in Bellingham, just across the border, and I'm still deeply committed to the causes that we are involved in here, serving on the National Board of the Hearing Loss Association of America, helping guide future research and breakthroughs by serving on review panels for the National Institutes of Health, and finally getting hearing loss on the map in various capacities through my roles with the World Health Organization, as well as trying to get hearing help to more people across the world through the Worldwide Hearing Foundation, as well as serving on many advocacy and non-profits boards. I do that through a foundation or through coaching and consulting. So I'm the founder of Lend an Ear Coaching and Consulting, and spending most of my time still in the advocacy space. So thank you for having me here today.
All right, Nicole.
Well, I don't know how to follow that. How do you follow Kelly Tremblay? But my name is Nicole Kingham. I am an audiologist, and I love seeing the names on the list there. I know I am familiar with quite a few of you. I want to just say hello in particular to the Fowlers, and nice to see your faces. And Karen, I think that your glasses are fabulous. Oh my gosh, I looked at it. You just look so nice today. Oh, those glasses are awesome. And a little bit about me. I am a private practice audiologist. I own a practice in Issaquah, Washington. And I am involved in quite a few national and Washington state organizations. I am on the board of Hearing and Speech in Washington state. And I look forward to talking to you today about a little bit about yesterday's board meeting. I know Diana was there, and I hope that she'll speak up at some point also to talk about her input yesterday. Just a little bit about me. I became an audiologist because my mother has hearing loss. She's actually the 56th woman in our family to have hearing loss. And I was the first one to tell her why she had hearing loss and what it meant for her. And I remember explaining to her the audiogram. This was during my master's degree at University of Washington, and explaining to her what she could expect from hearing aids, even though she had had hearing loss her entire life. And I remember looking up from the table and she was crying. And I said, oh my gosh, my first patient, I've already made her cry. But I was wondering why she was crying. And she said, because my entire life, I've gone this entire time not understanding why I have hearing loss, what the hearing loss meant, or what to expect. And so I sort of made it my mantra to make sure that people have the opportunity to understand from just the foundation of what hearing loss is, what it means, what their solutions are. So I'm looking forward to talking to you today a little bit about telehealth, and thank you all for inviting me.
All right, and then last but not least, we have Dr. Chad Ruffin.
Hi, I'm Chad Ruffin. I am a otolaryngologist or an ear, nose, and throat surgeon based in South Seattle, a suburb called Burien, where I'm in private practice. I see all types of ear, nose, and throat patients, but I think my absolute favorite is patients with severe and profound hearing loss, like myself. I was born deaf and am now one of the 4 cochlear implant surgeons in the world who have a cochlear implant. If that's not a mouthful of a sentence, I don't know what is. It has been quite a journey getting to this point. And One of my passions as a surgeon, a surgeon taking care of patients with severe and profound hearing loss who also has severe hearing loss. One of my passions is leading people through their hearing journey, because I think a lot of people, a lot of healthcare professionals focus just on the hearing number. How much speech are you hearing? What's your pure tone average? And as all of you know, as all of your stories have shown, being successful with hearing loss isn't about how much you hear, it's more about how well you communicate. And I can put a cochlear implant in someone and it will improve their quality of life. But really how much their quality of life improves is how much they focus on communicating and achieving their professional goals. So that's really my underlying passion, is helping people to function better with hearing loss. And for myself, when I see patients, I always see it in a combination of a medical, technological, and advocacy approach. You can't do one without the other. It's important to optimize people's medical conditions and make sure if they have any psychiatric diagnoses, that those are being managed really well, like anxiety and depression, because that's going to affect how well you function in life. It will affect your ability to advocate. And then I think it's very, very important that technology be optimized, that you have access to a great audiologist who understands not only hearing aids, but hearing assistive technology, and how you can incorporate that into your professional and personal life. And finally, as all of you in HLAA know, it's really, really important to learn how to advocate for yourself and for your community. And when you ask for accommodations, that's not, people often feel like it's like this formal process. Really, asking for accommodations is asking for help and learning how to do it, and learning how to be vulnerable in a manner that gets you the accommodations that you need. So that's how I approach hearing loss with patients. And it's really my passion, born of my own experience, challenges, hardships with hearing loss. And I'm very honored to be here today and in the presence of so many people who have done so much for the community. Like Sherry, Karen, Warren, everyone, Carolyn. I could not have gotten to where I am without the people who came before me. So thanks for having me.
Thank you, everybody. And with that, I think we're going to get ready to hear from the panelists. We have some topics where we are talking about telehealth and hearing loss, especially during these pandemic times. And then again, like I said, we're going to open it up for questions afterwards. So I am going to go ahead and start with Dr. Kelly Tremblay.
Thanks. Can you hear me okay, Tina?
Absolutely.
Okay, so we've all been asked to give you maybe 3 to 5 minutes of information just to start the conversation going, and that'll be tough to limit us, but we'll give it a try. And my job today is kind of to set the scene about telehealth. What motivated it? Is it working? Is it not working? And so I'd like to put that in a big context of we're experiencing disruption in many industries in our world, not only in politics, but in healthcare in general, and specifically hearing healthcare. And with that comes great opportunities, but also challenges. And this group today, I think we want to try and make sure that when we speak about telehealth, we speak about the pros, but also the potential cons or the disadvantages that come with telehealth. We're all trained in a way that assures that what we provide to the public is no less than a gold standard of service. So how can we advance the field while at the same time preserving the rigor of what we've got? So to give you a little bit of background, well, I just wanted to also just celebrate one disruption, and that was the example was the work that Sherry and Diana and I and others were involved by appearing in Olympia in front of the Senate and really championing the bill that now provides free hearing amplification for people who qualify through Medicaid. So here's an example of how championing can result in change. So now let's think about telehealth and why is telehealth a comment that we're discussing, a topic we're discussing today, and why did it come about? Well, there are many, many reasons, but one of them starts with what you and I all know, and that is hearing loss is such a prevalent and chronic health problem. It's one of the top 3 chronic health problems that affects all of us, no matter whether you're wealthy, you're poor, you live urban, you live rural, you live in a developed country versus a country with low resources. And we also know that about 1 in 4 people who can benefit from hearing help don't actually have access or don't actually have the resources to take advantage of that help. We also know that the most prevalent type of hearing loss is that does not require medical intervention in the form of surgery or pharmaceuticals. And so perhaps there are ways to work with those types of hearing losses differently, and those are usually tied to age-related hearing loss. Maybe there's a way to deal with those numbers of people in a way that allows more access to affordable and accessible hearing health, because we know that we have a problem of a low ratio of audiologists available to the number of people who could use our help. So if not everybody has access to this help, how can we improve that? Because we know that we want to have it's everyone's human right to have the accessible to hearing, to improved hearing. And as a neuroscientist, I know how important it is to get sound to the brain. So how can we do that? And that's one of the reasons why there's been a big push towards telehealth. So the pros and the cons of that is, the pro is obviously that, you know, we through telehealth, it gives access to more people no matter where you live. It allows people like Nicole and Chad to work with patients long distance. It may even, we don't know yet, prove to be more affordable and maybe keep costs down through insurance companies. Those data are not available yet, but that may be something. It certainly may be more affordable to you not to have to pay for parking, take so much time out of your day to travel to the appointment. And, but the cons, the potential risk is that we lose the quality of care that we can deliver if we're not able to be side by side in a room, knowing that this is not about just your ears or a device. As Chad mentioned so nicely, it's about human connection. And once you have this computer screen separating us, sometimes it can take away some of that intimate feeling and the intimate support that we are all here to provide. We also know that the devices and that we provide in the services through telehealth are not for everybody. Not everybody has the same comfort with technology, and we can't necessarily all provide the same services that apply to delivery of devices in the same way. So in some ways, technology can be a barrier. And so our focus of today on and telehealth is to help overcome that barrier. And so it's great to have Nicole and Chad here, who are on the front lines using telehealth, and to give you some of their solutions and share some of their experiences so that we can minimize that barrier and take advantage of telehealth, or at least let you know what your options are. So from that, I'll turn it over. I think I hit my 4-minute mark. I'll turn it over to Nicole.
Oh, hang on. I'm sorry.
That's okay.
Oh, you're on. Okay.
I'm on. All right. Thanks, Dr. Tremblay. For me, I get to talk to you a little bit about the audiologist perspective. So let me just say right off the bat, I absolutely agree with Dr. Tremblay that the first things first is understanding the technology and being comfortable with that. And I will say this again later, but I think we all, every one of us can be uncomfortable with change and the requirements that come about because technology is changing. And I hope at the end of my 5 minutes that you are encouraged to not only try something new and different, but also being an advocate for yourself, encourage your audiologist to also change, because I will tell you from my experience talking with my colleagues, we're just as up in the air as you guys, trying to figure out what's coming down the pike, trying to figure out exactly what we need to do to help our patients. So embrace the change, and we'll talk more about that. First, I want to talk a little bit about telehealth versus telemedicine. And I think just because I don't know about you, but it's sort of, what's the word we should be using? Is it telehealth? Is it telemedicine? Is it telecare? And really, it doesn't matter. They all mean the same thing, I think. But just to tell you, there is actually a difference between telehealth and telemedicine. Telehealth is something that is on the internet in the cyber world. So telehealth, I don't know if you may have a manufacturer's hearing aids that has an app, and the app allows you to make a diary input into the app that then gets sent to your audiologist. That is telehealth. Or say you have a pacemaker, and the pacemaker allows you to send information to your doctor without having to be connected to them face to face. That is telehealth. Versus telemedicine, where you may actually be one-on-one with your physician, with your audiologist across the cyber world, but one-on-one, that would be considered telemedicine. But I don't think any of us really care in the medical field. Whatever you use, telehealth, telemedicine, we all get it. But just wanted to give that little definition, just because it was helpful to me seeing all the different words going back and forth, like, what does that mean? So there's that. In terms of what we do as audiologists, we're using telemedicine. Now, really with almost every manufacturer, there's a way for me as an audiologist to connect to you, patient, without you having to come into our office. And we've even experienced where someone wanted to have a fine tuning of their hearing aids, and we were able to have them pull up to the curb, and I had my laptop. I was standing inside my office, door closed, they stayed in their car, and I was able to connect with them and do a fine tuning. That is technically telemedicine. So that is a new and strange thing for me, but it's what we need to do right now, given our current situation. But what it means is that you as a patient have choice. You can take the new technologies that are available, and you can connect with your audiologist when you need to, where you need to. So if you choose to stay home due to safety or due to it's convenient, you now have the option to do that. And actually the technology's been around for quite a while, but again, I think it just has come to the forefront because of what's happening around us with the COVID-19 pandemic. So we have the opportunity to, again, change the way that we've offered services to benefit you. And I want to encourage you again, make sure your audiologist knows it's something you want, because it does take quite a bit of learning. It does take some new technologies to connect with you that way. but it's available. And when audiologists hear that their patients want it, they are more apt to go about it. So what do you need if you're going to do an appointment with your audiologist virtually? Well, you have to do a video call. So what that means is you need a computer or a tablet or your mobile device with a camera and a microphone. So most of us have something like that. You're using it right now. And that's really all you need. Besides that, you need to make sure you have an updated browser. So Safari, Firefox, or Chrome. Just make sure that before you decide the first time to jump into the virtual appointment, make sure you have an updated browser. And then to make it a great experience, you want to have strong Wi-Fi or an Ethernet cable. And think about it like this. You're on camera right now, and you might look at yourself once we're all back on camera. How do you look to yourself on camera? Is it hard to see? Can I see your lips? Can you see mine? Is the lighting good? How is the sound? Those things are things you don't have to consider when you're walking into an office, but you can help me as an audiologist just as much as I can help you by making sure that the background is convenient or is good for communication. And the last thing really is that I would say as an audiologist, I've gotten quite a few emails saying, hey, let's set up a virtual appointment. Can I call you at 8 o'clock? And just so you know, it really is going to work just like any other appointment. So in our clinic, if you were to call the front desk, you could say, I'd like to have a virtual appointment. We will set it up just as if you were coming in the front door. So there will be a specific time that we will agree to meet. So yes, communicate with your audiologist, but assume that you're going to have a scheduled appointment for communicating virtually. Then I want to just quickly at the end here, just review, what does the law say? Does the law say that we can even do this? And the answer is absolutely yes, that we are actually covered under HIPAA regulations so that we can offer you these virtual appointments. And I want to say first, thank you to Dr. Ruffin for giving us information about the Health and Human Services Guidelines that says that it doesn't actually have to be inside a manufacturer's platform. So if you have Phonak or Widex or Oticon hearing aids or Signia, whatever, you don't have to use their platform in order to talk to your audiologist. If you would like to just have a video call one-on-one just like this, you can request it. It can be done through FaceTime on your phone. It can be done through Facebook Messenger. It can be done through Google Hangouts. It can be done through a Zoom or Skype message. So there are all sorts of ways that we can meet virtually to make sure that your audiologist has good communication and connection with you. All you have to do is request it. And I did want to let you know that yesterday during the board meetings, Board of Hearing and Speech, that there was reference to some new telemedicine training standards that are required for audiologists. So now we all have to do training starting January 2021 so that we are up to date and up to speed on how we can perform these virtual appointments with you and do it well. And the last thing I wanted to just say, and I'll hand it off to Dr. Ruffin here, is again, it's different. For me, it's exciting. I don't like wearing a mask. I don't like that it changes my communication behaviors with my patients. I try very hard to wear a clear mask, but my experience is the clear masks actually decrease the speech understanding with my patients. So yes, you can see my lips, but now you can't hear me as well. So these virtual appointments actually make it much more, I'm more apt to communicate well with you. And so I want to just, again, ask you to be your own advocate, to go to your audiologist and say, please, let's try a virtual appointment. Just give it a shot. And I will look forward to hearing from you guys and your questions soon. And now, Dr. Ruffin, you're on.
Can everyone hear me okay?
Yes, we can
Okay.
hear you, Chad.
Great. I had to switch between a different audio feed here. So I think that Dr. Tremblay, well, I don't think, Dr. Tremblay and Dr. Kingham gave great introductions for telehealth. I actually had to reorganize what I was going to say because they did such a fantastic job. I want to add on to what Dr. Kingham was saying about what your options are. So sometimes I have patients, they can't figure out the telehealth application and they want to come in by telephone because it's so much easier. The problem is that twofold. One is that the law doesn't allow us to bill for a telephone visit. It has to be a audio-visual video visit. There's no way that we can get paid and for that. We do get paid for a telephone visit, but it is far, far, far less. It doesn't cover the cost of your visit, to be honest with you. So that is one of the reasons why we are insistent on video visits. The second thing that I want to say and kind of segue into my comments is that I'm actually really excited about the telemedicine. I think that for some patients, it's a great choice. For me as a doctor, it allows me to expand my reach. For example, one of the things that I'm working on is creating a telehealth clinic that goes across the United States. And as I mentioned earlier, I focus on a unique perspective. I combine medicine, technology, and advocacy. And many patients, many people will contact me online and say, what stethoscope do I need to use? And as I've gone to talk to people, I realize that they don't have great hearing aids. They have medical issues that are getting in the way of their professional performance. And then they don't really advocate so well. So telehealth is really exciting for me because I'm doing a very small clinic where people can call in across the United States and get professional advice on how to perform better with hearing loss. So as a physician taking care of traditional patients that come to me, I find telehealth to be easier after the patient-physician relationship has been established because patients are in their home. They're much more comfortable on their own turf. And I think the key benefit for telehealth is that it makes it really easy to bring a significant other or a caregiver with you so that they can hear what's going on and ask questions as well. So, if you have a meeting at home, but your partner is working across the city, they can easily dial in and both of you can be in at the appointment at the same time. And this has been shown to improve outcomes for people in medical appointments if you can bring someone with you. I think the cons for telehealth is it's really stressful for people who are not savvy with technology. And usually these are people who are older, but not always. So I was going to go through and give you some tips on how to, what to expect and how to optimize your experience. And I think that it's super important to advocate for yourself. If you need an interpreter or captioning or something that makes your different visit from other patients, you need to ask for it well in advance. Just like you're often the first person at a job who has hearing loss, you will often be the first patient who has hearing loss or severe hearing loss in the clinic. So you're probably going to have to educate the clinic staff, and you're not going to be able to do that at the last minute. So start as early as possible. Usually in a traditional visit, you get about 15 minutes before the appointment to get your paperwork and everything updated. What I would suggest is treat a telehealth like a traditional visit. Maybe the day before, log into the platform. they often have a test interface where you can test your connection and everything and the setup. So get familiar with that and make sure you set yourself up for success. Make sure that your bandwidth is optimized for the video. Don't be jet streaming something on the TV because TV use takes away from your video bandwidth. So your video will get slow, your audio will get choppy, and it will make for a terrible experience. One other comment about the captions interpreter. Say you arrive at the appointment and the interpreting service isn't great, the captioning isn't great, and you're very frustrated. What can you do? You can definitely ask to use Facebook Messenger, you can use FaceTime, you can use any platform that is basically a one-to-one secure connection. So let this office staff know that and be prepared to use that before. Now, say that even that doesn't work, it's stressful, that sort of thing. Telehealth is a little bit easier to schedule once you get it going. Like if we have problems in my clinic, I have no problem staying after 5 p.m. and adding and seeing a patient on at the end of the day because it's usually easier. I don't need other medical staff to prep the patient, to get them ready for their appointment, take vitals, all that sort of thing. One other thing that's kind of funny is as physicians, we do everything we can to make sure you have a short waiting time and see you on time. But it's really, really, really hard to do that sometimes. And our front staff doesn't always know the amount of time that someone needs for an appointment. They can't predict that in advance. So just because your telehealth visit says that you're going to start at 3 p.m., I may be late. I probably will be late because I may have had someone with a new diagnosis of Meniere's and they were scheduled for 30 minutes and they really need 45 minutes, sometimes close to an hour. Sometimes we're juggling audiograms in one room, lab results in the other, and we're trying to keep 3 rooms going at one time because there's overlap in patients and resources sometimes. But we are doing everything we can. And the beauty of telehealth is that we can catch up later if necessary. And to be honest with you, I don't know if that's the mindset of other, sorry, I'm just checking my timer here. I don't know if that's the mindset of other doctors, but that's mine.
Thank you, Dr. Ruffin. I am at this time going to add everybody's all of the panelists back on the screen so that we can have our question and answer setting. So right now I'm turning on everybody's camera, and if any of you have any questions, again, please type it into the chat box or raise your hand. And let's see. So far, I do not see any questions. I do have a question though. So for all of you, any of you can answer, how are you accommodating patients in terms of captioning? Are any of you using any kind of caption tools while you're trying to do teleaudiology? So
Chad and Kelly are both muted, so there's Kelly. I actually, are you talking about the virtual appointments, or are you talking about one-on-one with patients?
both, actually. Just so you know, I see that we do have 2 other questions, so, okay.
I actually really love the Ava app. I think it works really well. Sitting right in front of a patient, I can actually turn it on my phone and turn it around. And then I get to teach them also about the how to use Ava. I think Ava is really simple to use. The new Google app as well is really good, but you have to have an Android to be able to use that easily. Otter for me as an audiologist is not, to use Otter well is expensive. So I've been using the less expensive options. In terms of the manufacturers, this is a great thing I can bring up to some of them. I'm on some of their resource boards. There isn't a captioning option through the manufacturer's platforms. So that is something that I definitely can bring up to them, right? Yeah, so.
Thank you very much. Dr. Ruffin or Dr. Tremblay, did you have anything that you wanted to add to that?
No, I just think we all gravitate to our, what resources are we're more comfortable with. And so I would encourage people to do that as well. And I don't see patients anymore, but on almost everything I do in terms of advocacy, I now use Google Meet and turn on the captions, even if I'm meeting with people who are not hard of hearing, because it allows them to see that captions, the speech to text options are available. And it's an educational opportunity. It's an outreach opportunity. And I also use Live Transcribe a lot and recommend that to communities. If you have because those are just free technology options that that are out there and do a good job.
Okay, thank you. So at this time, I think I'm going to unmute first Diana Thompson. And I will add her to the spotlight. Go ahead, Diana.
Okay.
Oh, you need...
First of all, I just would like to say hi to Kelly because I haven't seen her in a very long time and we used to work on and off closely together. So I hope everything is going fine for you, Kelly. And then I have a question for Nicole, and maybe you covered it and I didn't catch it. Do you give hearing tests using telehealth, and can you and would an audiologist that sells my kind of hearing aids, which is pretty common, Phonak, be able to with telehealth then reprogram my hearing aids?
A great question, and the answer is no. And the reason is not because it's not available. It's because Washington State doesn't allow it. So in Washington State, we have to do very specific testing to be considered diagnostic. And that diagnostic test includes something, bone conduction in particular. And there isn't a way for me to do that virtually. So that test, which is required in order to be approved or thought of as the diagnostic test prior to a hearing aid fitting, we're not able to do that virtually. We can do a quick hearing screening to see if something's changed, but personally, I don't think that information is, it's sort of like a snapshot. It gives me an idea of whether we've got an issue we need to deal with right away. But for especially a new patient, I would never ever consider doing a virtual audiogram in any way.
I'm going to go ahead in the interest of time and ask some of the questions from the chat box. So is there a link to a list of best practices for audiologists?
Would you like me to answer that, Kelly? Okay, so I'm going to assume that this is best practices in terms of what it takes to have a good hearing aid fitting. And best practices are something that are getting a lot of attention right now due to Dr. Cliff Olson. And he has a great listing of what best practices should look like in an audiology practice. So if you haven't heard of Dr. Cliff Olson, you've been under a rock. But if you haven't, go ahead and just search his name in any search engine, and he has a list of best practices. I think it's a very good one. The typical best practices considered
My hand up here.
best practices by American Academy of Audiology. They do have a listing of what best practices are considered. I think it's more of a guideline, but in terms of you as a patient saying, I want to look for an audiologist that does these things that are best practices, which is real ear measures, speech understanding and noise, etc. There isn't actually, I think Dr. Olson really is the only person that has put anything out online that shows what you should be looking at in terms of patient care.
Dr. Tremblay or Dr. Ruffin, did you want to add to that? Go ahead, Chad.
Is my microphone on?
It is.
Okay. I think it's really important that I unfortunately think it's important that patients educate themselves on best practices because as I mentioned earlier, there is such a wide variation in medical, audiological practices. And because of so much information is out there in the research world, and so much of that information is siloed, not everyone is doing best practices. So it takes a lot of effort for a practitioner to stay on top of things. So I think that when you recommend patients to different areas, to keep that in mind, because real ear is actually not, from my patients that I've seen that come to me, they don't always get real ear, which is super necessary once you get down into severe, profound hearing losses.
Okay, thank you. So Jerry, what is your question, please?
Oh, once again, can you hear me now?
I can hear you now.
Okay, I wanted to thank HLAA of Washington for organizing this meeting this morning. And I would specifically like to thank our 3 panel experts for sharing their knowledge and expertise. My question is for Dr. Ruffin. I see that you're wearing earbuds. And so my question is, one of the panelists talked about trying something new. I had my first cochlear implant in 2016, and then my second dual in 2019. I'm curious as to what you are using the earbuds for that you have on while you are communicating with us, because that's something new that I would possibly like to consider for myself. So could you explain why you have the earbuds in and utilizing them at this time, please?
Sure, Jerry. So there are 3 cochlear implant brands, Advanced Bionics, Cochlear Corporation, and Med-El. Those 3 are the most common devices used. I am most familiar with the Advanced Bionics and Cochlear brands. The approach by the 2 different manufacturers in allowing you to connect hearing assistive technology is somewhat different. Cochlear Corporation focuses on direct streaming directly from a phone to the cochlear implant, usually today without a gateway device, such as like the Compilot you have to wear around your neck or the mini mic. Advanced Bionics has traditionally used a gateway device for this, and I just don't like gateway devices. I'm a terrible patient. I don't charge my batteries like I should. I am not going to carry things around with me. And so I use, on the Advanced Bionics, I use the T-mic. So the T-mic, Advanced Bionics focuses on this. There's a little T-mic. So the mic is at the end of the processor, not right here. So that's how I can use an earbud. And it's much easier and much more convenient for me to use an earbud than it is for a gateway device. I don't have to, this actually helps me make a very important point and one that I use daily. So using a gateway device is going to introduce audio-visual lag, dyssynchrony. So I can't lip read and use audio at the same time and easily. And that easily is a really important point because your brain is working overtime to hear. If you introduce another source of work, it's going to make it harder for you to hear and thus harder for you to communicate. So that is the sole reason I use earbuds, to make it easier, because I don't just focus on hearing, I focus on the ease of hearing so I can communicate better. Great question.
Thank you.
All right, so at this time, in the interest of time, we are going to go ahead and move forward with the rest of the meeting. So the panelists have graciously agreed to stay on. And so please hold your questions or type it in the chat box. And hopefully at the end of the meeting, then we'll be able to come back and address those. We've had great conversation so far. So I'm going to go ahead and turn off everyone else's spotlight. And I'm going to leave Sherry on so that she can continue on with the meeting.
Weren't these guys amazing? Could we all give them a great hand? Thank you so much to Nicole, Kelly, and Chad. You just did a great job sharing your experience and expertise with us. So thank you very much for making yourselves available to us today. So as we just discussed, hearing loss in healthcare can be very challenging. And at HLAA Washington, we want to advocate for better communication access in healthcare. And to do that, we need to have your stories. So we have the slide up, we have our email. Please email us with your healthcare stories.